Community Spotlight on Z102.9.
Good morning. Welcome to May, first day of May. It's Community Spotlight with Z102.9. Across the room from me, Joe Locke, President and CEO of Eastern Iowa Health Center. Thanks for coming in this morning.
Thanks, Eric. It's a pleasure to be here.
Joe, we've had the fortune to speak with Eastern Iowa Health Center many times on Community Spotlight, and I always want to start with the general question of who you are and the services you have, because it's a rather unique situation.
It is a unique situation, Eric. We at Eastern Iowa Health Center, we do 5 things. Family medicine, so just like when you go to the doctor. Pediatrics, which is pretty self-explanatory. OBGYN, our 5 OBGYN surgeons delivered 622 babies last year. Let's see, we also do dental and behavioral health, so therapy and counseling things, that kind of thing.
And because of the way you are organized and funded, that also dictates, is that the right word, the type of services and maybe the patients you can offer those to?
Well, first of all, you're correct that our services can be delivered to anyone in the general population. However, we focus on those that are uninsured, underinsured, and the Medicaid population.
And as I look at Cedar Rapids and the makeup and considering the influx, for example, of Afghan refugees, right? There are different populations that are very thankful that a service like Eastern Iowa Health Center is here for them.
Well, that's true. We actually have seen 100% of every one of the Afghan refugees that have come into Cedar Rapids. Their first stop is the public health, is Linn County Public Health, to make sure they don't have a communicable disease. And then they come to us with 90 days of Medicaid to become their medical home.
Joe, you have a lot of exciting things on the horizon, one of which is a new dental health center. What's happening with that?
Well, we've had a dental health center here in Cedar Rapids for 5 years, but we have outgrown it. And so right now, we do about 9,100 visits, dental visits per year. This new facility will give us the ability to go from 8 dental chairs to 18 and go from that 9,100 visits a year to, at minimum, 22,500 visits a year.
Wow.
And so we're in the final stages of fundraising for that. We are a nonprofit. And the thing that really makes us unique is that if a patient can't pay, we treat them anyway. And so we do a lot of fundraising and philanthropy, both from individuals and corporations and foundations and things. And we are very close to our goal. And we're really looking forward to breaking ground, hopefully in late July or early August.
So break ground on this new dental center then this summer. Would that be ready then by 2023?
Yes, we're targeting about 10 to 12 months of construction. So mid-2023 is what we're looking at.
Our guest this morning on Community Spotlight is Joe Locke, President and CEO of the Eastern Iowa Health Center. Well, with such vital services provided to so many different populations in our community, for people who want to learn more and specifically donate to this great cause, and whether it's the dental center or other projects, how can they get in touch or learn more about you?
You can go to our website at www.easterniowahealthcenter.com.
That's nice and simple. Is it also the same portal or website if a family is looking for services?
Yes, it is. So they'd be able to go on there. Our phone number is 319-730-7300.
And as we get closer to the summer and about ready to wrap up our Community Spotlight this morning, anything else exciting and new on the horizon for Eastern Iowa Health Center?
Well, really the best thing, Eric, is the fact that we'll see about 60,000 patient visits this year at our 4 locations here in Cedar Rapids. And with the new dental clinic, that will